All right. Well, good afternoon, everybody, and thank you so much for dialing in. I'm joined today by Scott and Tana here from Care&Care, and the next hour we're going to spend going over the 2020 Medicare Advantage benefits for Care&Care. Before we get started, I just want to make a couple housekeeping items, and one is that everybody's in listen-only mode. So if you have any questions, we'd love to hear them, and we'd love for you to put them in the chat. And as we move through the presentation today, Scott and Tana and myself will read the questions and make sure we get all of your answers. We couldn't be more excited to be partnering with Care&Care this year. There's going to be a lot of disruption here in the DFW market, and I can tell you after looking at the Care&Care benefits, it's probably the best plan on the street here, and Scott's going to tell you exactly why you want to make sure you've got Care&Care in your briefcase for 2020. We're going to run through not only the product, but the ways that you can partner with Care&Care here locally through us at the brokerage and Care&Care and all the local support that's going to be available for this upcoming AEP. The information that Scott's going to present to you today, most of it is on our website. So if you go to www.thebrokeraginc.com and you log in, again, all this information that we're talking to you about today cannot be marketed to consumers until October 1st. So for that reason, we have to keep all this information behind the curtains and it's password protected. But if you get a login, you access that just right on our website, you'll be able to see all the benefits that Care&Care has to offer for 2020. And again, you can go on our website and get things like contracts. So if you are not currently contracted with Care&Care, please either call our office directly or request it online so we can get you set up today. There's information there about certification. So what is the process to get certified with Care&Care? You'll find all that on our website. You can also learn about things like our Brokerage Bucks program. What's ways that you can market more Care&Care? That's selling 8 for a 9/1 effective would get you a 1,000-piece mailer or $450 to start marketing for AEP or for any sort of marketing purpose. And that's 8 apps with any carrier combined. Could be Medicare Advantage, could be ACA, could be Medicare supplements. The only thing we exclude is PDPs. If you need E&O insurance or access to our call center, or you want to get information on our MedSup quoting engine or access to Connecture to where you can do online enrollments, all that is available on our website. So we encourage you to take some time, visit our website, thumb around, and find all this information that we're talking to you about today. So I won't take up any more time. Without further ado, I just want to turn it over to Scott and Tana. So guys, take it away.
Awesome. Thank you. Good afternoon, everybody. This is Scott Hancock with Care&Care, and Tana, introduce yourself.
I'm Tana Kirsten with Care&Care.
All right, we are obviously very excited to be here today to kind of walk you guys through just a little sneak peek into what we're doing for 2020. Last year we did this presentation. It was we had fun with it, and we called it the top 10 reasons that you didn't want to sell Care&Care. This year we're flipping it on its head a little bit, and we're turning this into how you can be successful selling the plan. We're going to go through some really important items today. And again, like Josh said, if you have questions, feel free to put them in the chat, and we will get those answered. We want to answer them as we go and make sure we get you what you need out of this. The goal is to make sure everybody understands who we are, what we do, how we do it, what makes us a little bit different, and definitely why you would want to be a part of Care&Care and our success as well. So we're going to jump right into this. So the first thing we want to talk about is finding a good partner. I think when you talk about, you obviously can sell a lot of different Medicare programs out there. And one of the unique things about Care&Care is the fact that, first of all, we're here. We're here in Fort Worth. It's not just you have a few agent managers here in the area that live in the area. Our whole company is here. Our operations are handled here. And we're here understanding the needs of the people that you potentially will enroll into the plan. One of the key things is that we are that local plan with accessible support for agents. You have access to Tana, you have access to Tom and Elaine as well, and we want to make sure that we're here for you, not just to answer some basic questions, but to figure out how to help you grow your business, how to plug you in. I think that's one of the tough things that people always have told us in the past. They're looking for opportunities, they want to figure out how to create more business, and we've really worked hard to build a model of how we could plug you into places and other options and other opportunities to try to grow your business along with Care&Care. Another thing that makes us a good partner is obviously our concierge program. We've had this since the beginning. And a lot of plans have recently started trying to mimic what we do with this program, and we think it's a really great program, and we understand why they do. But when you sign someone up with our plan, they are assigned to a concierge. This concierge is not just someone that they can call and have a single point of contact that can just answer their basic questions or help them with claims and things like that. But it's also something that we use as a relationship building tool with our members to make sure that they stay members. You know, it's important to us that you've done all this hard work to get them to sign up for our plan, that we do everything we can on our side to make sure that they stay members, so that hopefully you're not getting tons of phone calls of them being upset or them needing to change plans because they don't like the plan, and then you're not really being able to build your renewal base the way you would like to. You know, some of the other things that they do is they call the members on their birthdays, not just their physical born into this world birthday, but their birthday with the plan as well. So their anniversary date, they call them on that date as well. We do want that concierge to be a one-stop for all of their needs. So no matter what their problem is, they should feel comfortable calling that concierge and saying, hey, I need help. Can you do this for me? And they're going to be the ones that are going to help navigate that with them along the way. And then the last thing that makes it really, really unique here for our plan, and the fact that we are local, is that if your customers want to go visit this person, they can. They can walk in our office over in Fort Worth and ask to meet with them, and they will come out and meet with them face-to-face in a room we've set up for them, so that they can help them solve the problems that they may be facing. Maybe it's even just to say hi or whatever. We enjoy that in-person contact with our members to let them know that they're special and we want to take care of them. And then the last thing on here that makes us a really good partner is our relationship with Southwestern Health Resources. Last year we were purchased by Southwestern Health Resources, which means we're a part of both Texas Health Resources and UT Southwestern. You know, what this did for us immediately was give us a much larger network than we'd ever have. And it does give us a robust, high-quality provider network. Having the THR doctors and all the facilities is really nice, and then wrapping it with the UT Southwestern Medical Center and all that it brings to the table is something that's an exceptional value. And knowing that not only they're not just in network, but they are part of the company that we are a part of, makes it even a much better relationship to know that the things are going to be a little bit more coordinated possibly. Next thing about Care is we want you to sell where you live. You know, since I started out as an agent, I've always been talked about to that and trained that way, is that it's always, you don't have to drive all over the world to sell. It's always nice to sell in your backyard and be able to build a business. We understand that there's a lot of agents that sell Care and they are in different places. So we want to continue to expand and grow our footprint and offering you opportunities to work in your own backyard. So for 2020, we are adding 4 new counties. You'll notice that they're mostly to the west, other than Cook County, which we are going to the north. We're almost to Oklahoma there. We're touching the border. We're trying to get to casinos, I think. So these 4 counties, Erath, which is the Stephenville area, Palo Pinto, which is Mineral Wells, Somerville, which is known as the Glen Rose area, and then Cook County, which is Gainesville. We've been working to build networks in those areas. I know Tana sent out a survey to everyone that's already a Care agent, that if you have providers in those areas that you think would be a good fit for our network and maybe they're not in right now, we would definitely ask that you would send those over to us and let us make sure that we can get those contracted prior to AEP, because we still have time to get that done. Some of the things that we're doing, not only in those areas, but in all of our service area for this AEP, is we are going to have some very strong marketing efforts, not just direct mail, but we are also doing a lot of digital. We will be doing some really, really heavy runs on television this year to make Care very relevant, so that when you do walk in the house, they know who we are. They've seen the commercials, they've seen the information about us, that way that they can have some comfort with who Care is. And then the last thing is that we're taking all of our products to all counties. Last year we did this when we expanded a little bit, but now this is the marching orders that we will take into all our new counties, is that we're not going to go there with just the HMO or just one of the PPOs, but we're taking all the plans. That means places like Stephenville, Texas are going to have an HMO option with an exceptionally high value proposition that they have never seen before. So you're going to be in a situation now in some of these markets to walk in and truly offer disruptive products that have not been offered in these markets. So we're very excited about that. Then it comes to the options. What are the options that we are going to have? We didn't add any plans. We did make some changes to our plans, but we still have our 4 PPO plans and 1 HMO plan. 3 of the PPO plans you'll see at the top there all have drug plans with them. The first thing you might notice is that the Care Choice Premium Plan now shows $200 a month in premium. You might be looking at that and going, why would I ever sell an MA plan with a $200 a month premium? I'll cover that here in a minute and you might understand. Secondly, the Care Choice Plus plan is $55 a month. That plan is 55 currently. We really did not make a lot of changes to that plan. It's going to look and feel very, very similar to the way it is right now. And then the third one there, the Care and Care Choice Plan, is still our premier product, our zero premium PPO plan. It is obviously the most popular plan that we offer. We really didn't make a lot of changes to it either, just a couple of things that I'll cover here in a minute. But it should still be very, very attractive for folks, and they should be really excited about being a part of that. The MA only plan, we do have an MA only plan that is a PPO with a $0 premium as well. And then our HMO plan, probably like as Josh said, some of the richest benefits of the plans in this market that you're going to see. Our Care and Care Classic HMO is still a $0 per month premium. Benefits wise, let's talk about what we did with some of these things. I talk every year, it seems like when I go to the brokerage event that we do in September, which I'll stand up there again this year in September and talk about how consistently boring we are with our benefits. I'm going to have to offer one caveat this year with this $200 plan because it is significantly different than what it looks like right now. Currently, it's a $119 plan. In the past years, people have asked me, why would you sell it? I struggled with the reason to say why you should sell it because the benefits really weren't that much richer than what you could have gotten in the $55 plan or even the $0 plan. So when we sat down and talked about what we could do, we really wanted to bring something unique to this plan and actually make it something that you could sell, make it something a little different that you might not see. So what we did with this is we did something really different and we got rid of all of the copays for all in-network medical services. There's a little asterisk there because the only thing that's not zero in this plan are drug copays, hearing aid copays, and routine hearing exams. Everything else in network has a $0 copay. That's PCP visits, that's specialist visits, that's inpatient hospital, that's SNF, that's everything down the Part C side, $0 copays. So that's a huge change. Still, some of you may go, well, that's $200 a month. Why would I still do that? Well, great thing about it is that for this $200 a month, you get our drug plan with our formulary, the same one that's in all the rest of the plans. This also has $0 tier 1 drug coverage in it and all the other benefits that you get with all of our plans, the dental, the vision, the hearing, the fitness benefit, all of that rolled up into one nice $200 a month premium. So if you have people that are in maybe a Medicare supplement or something, or maybe have some health conditions that they can't qualify and they need to limit some expenses to a fixed amount, they can do it through this plan. The great thing about this plan now also is that you can still go out of network. Now the out of networks are not zero, but they're exactly what they are today. We did not change any of the out of network benefits for 2020. The Care and Care Choice Plus plan, unfortunately, this is the one for 2020 is the one that was just kind of left out. I couldn't do a whole bunch to the first plan and this one, so I focused on the first one this year. The Plus plan is still a really, really nice plan for a PPO plan. Yes, it's $55 a month, but you do get a $3,400 in-network max out-of-pocket and a $5,100 combined MOOP. That's a combined in and out, not a separate out. You also have some really low drug copays on this. So if you ask me this year who might be interested in this, this might be somebody that's willing to pay a little bit more premium, obviously $55 more than the zero premium, to get a plan where they could lower that out-of-pocket down some and be in a little bit better situation. The last plan there, our Care and Care Choice plans, our zero premium PPO plan. Again, our most membership, our largest, our signature plan, and it has been since the beginning. Things that make it special, if you don't know a lot about Care and Care, is the inpatient structure on it. It's $250 for the first day, and it drops to $125 a day for the next 5 days, which makes it $875 out of pocket. Worst case scenario, if you go in the hospital, it's one of the lowest inpatient copay structures in the market. Our specialist copay on this plan looks like most of the HMO plans that you'll look at out there for the in-network side. And the out-of-network benefits on it are exceptionally rich as well, so you get people that have the flexibility. So when you're sitting down with someone and they really like that $0 HMO, but maybe their doctors don't completely fit, or maybe they're just one of those people that said, I don't want an HMO. The Care and Care Choice PPO is a really, really high value option to give them the choice of a PPO, but with some of the value that you would normally see in an HMO plan. The MA only plan, also a $0 plan. This is really perfect for people who are VA, TRICARE, have other insurance out there. Some people have always asked me, well, why would they want it when they can go to the VA and they don't have any cost, or they got TRICARE and it pays for everything? I get that, and there's nothing wrong with that argument. But for those people that are already doing this can be a perfect pairing because it coordinates with all of them to give them things like dental, vision, hearing, a fitness membership through the gyms, some of the extras that you don't get with these other programs. It allows them to have those things. Then the last plan there, the Care and Care Classic HMO, the $0 HMO plan, $0 PCP copay. It has a $15 specialist copay, which is the lowest in the market. And the inpatient benefit is even cheaper than the PPO at only $525, which represents $225 for the first day and then $75 a day for the next 4 days. So very, very low cost for having an inpatient stay. And then the last thing of note that is really nice on this plan is that the dental office, the preventive coverage that comes built in the plan, does have a $0 copay for your oral exams, your x-rays, all of those items like that. Do you want to take that question?
Yeah, it looks like we had one question come into chat here from Suzanne. Do members have access to the whole Southwestern medical system for referrals? That's the first question. Second is also, have you added primary care providers in the Dallas area?
So the answer is yes and yes. So yeah, the way our referrals work is they can be referred to any of the doctors in our service that are part of Southwestern Health Resources. And all of the UT Southwestern faculty doctors, as well as their employed doctors, are in network for Care and Care. The only exception to that is there are a couple of providers up in Frisco that are concierge medicine providers now, and they're not in Medicare. So we actually can't do anything with them, and it's not by choice. It's because the practice model that they've chosen. And then have we added primary care providers in the Dallas area? We're constantly adding providers. And I would challenge you, Suzanne, that if you have providers that you would like to see in the network, please feel free to send their information over to Tana, and we will do what we can to try to get them in network for Care and Care.
All right, a couple other questions came in. So one from Justin here. So are you saying that Care and Care MA only options coordinate their benefits with a TRICARE for Life member? You would be the only carrier that does this on the seamless level. Otherwise, additional paperwork is required to cover benefits.
It's always required, unfortunately, with TRICARE. We would love to have a seamless model, but the way that TRICARE looks at other health insurance, when you have other health insurance, it becomes a little bit of a filing issue. It will cover it, but yes, there are some things. So potentially you could have, if a doctor does not want to bill it for you, the member could be in a situation where they would have to pay the copay and then resubmit the information to TRICARE to be reimbursed for that.
Perfect, thanks. Next question is, do you have a complete AHIP to be appointed, or do you have to complete AHIP to be appointed for Care and Care?
We don't require AHIP. However, we do offer an option where you can take the core training that's offered in our certification that is unfortunately not live yet. I think you're expecting here in the next week or so.
Yes, absolutely.
So if you already have AHIP, you can contract now. If you want to wait for that and not do AHIP, you will be able to do that once core is up. That's out of our control. Unfortunately, our vendor creates that.
Excellent. Thanks for putting those questions in chat, guys. Keep them coming. We'll move on to the next slide now.
Excellent. All right. Next thing we want to do is, we want to talk about cost barriers. I realize that when people are looking at healthcare, it's expensive. Those are one of the things that I really take this personally when I sit down and I start trying to figure out what we're going to do with our benefits and how we scope things so that people can afford to have healthcare, but at the same time afford things like food, drugs, transportation to get somewhere, some of the luxuries in life. People work really hard all through their lives to be able to retire and enjoy life, not to have it completely sucked up by healthcare. So I take that personally and I look at that when I build these benefit structures, and I really want to remove some of the cost barriers to why you would choose our plan. I think the first thing of note, obviously, we do offer zero premium options with both our PPO and our HMO. The second bullet point, I think, is one of the key ones that we have done year in and year out, and I love to say I'm consistently boring about, is that we still don't have deductibles on Part D. Almost every plan out there now has a Part D deductible, whether it be on Tiers 3 and 4, Tiers 2 and 3, or 4 and 5. All of them are starting to work in deductibles on Part D. It is a mission each year when I sit down with our pharmacist that we figure out how we can not only maintain our formulary that we have that we think is exceptionally valuable, but keep deductibles off the table. And for 2020, we are still going down that path where we will have no deductibles. Another thing, no preferred pharmacies. No worrying about, well, I only get this price if I go to X pharmacy. Our pharmacy network is actually a little over 63,000 pharmacies nationwide. So while we may be a local plan, we have a nationwide pharmacy network. So even if you're out traveling and going about and you need a refill on drugs, you will be able to find pharmacies in our network that you can get your refills at. Another nice thing that we've always done is our 90-day supply for all our drugs, no matter what tier. If they'll fill them for 90 days, you can get them for 2 copays instead of 3. So you immediately save a third copay on a tier 3 or a tier 4, which can be $40 to $50 or $95 to $100 depending on the plan you choose. $0 copays on tier 1 drugs on both the HMO and the Choice Premium plan. A $0 PCP copay on the HMO. $0 lab copays, X-ray copays, diagnostic test copays on both the HMO, and then of course the Choice Premium since there are no in-network ones, and the MA only plan for in-network. The only caveat on that is if you do step out of network, or rather on the MA only, if you go to a actual hospital facility to get X-rays or something done, there'll be a $5 copay for those. But other than that, there's 0 copays. We want to make sure the exposure to our members is as little as possible so that they can get the care that they need. All right. Next thing, protect our assets. Again, I'm a licensed agent. Before I started working for Caring Care, I worked with the brokerage. I sold a lot of products. And one of the things that I always talked to my customers about was how we were going to make sure we protected the things that they had worked their whole life to save. Again, this ties back to quality of life, the ability to do the things that they want to do. And I watched a lot of people make decisions about med subs because, well, I could fix my premium, and I knew that I had to pay, well, maybe $130 today, and maybe it goes to $140 and up later, but I knew it was a fixed amount. So when I look at what I do for these MA plans for Caring Care, I want to make sure that we put the most protection we can put in place. So you'll see on this very first line up here, the HMO, our max out of pocket is now only $2,900 for next year. That's obviously below $3,000. It's below the $3,400 that you see in most of the plans. And I haven't seen anything, maybe somebody can tell me different. I have not seen anything lower than that in our market. I think it's by far the lowest max out of pocket. I think this is a really nice thing now because when you are talking to someone that maybe is looking at that Medicare supplement decision, or maybe they're a little bit aged further in, when you add in the premium plus the Part D premium, plus the Part B deductible, because next year you're not going to be able to buy an F plan, plus the deductible on the Part D plan itself, you could be creeping up on $2,900. So now they're going to be in a situation where they're going to say, I know I will spend $2,900, or maybe I'll spend $2,900. You can now make a case for some of that, even with a lower cost supplement out there on the market. The next thing there right below it, the Caring Care Choice Plan, again, that's our 0 premium PPO. The max out of pocket is only $3,900 in network. That's like a lot of the HMOs in our market. There's a few HMOs that have gone down to $3,400, but we have a PPO now that's at $3,900. The out of network is at $7,500, and actually that's a combined in and out. All the other PPOs in the market for the most part are sitting at $6,700 and $10,000 for their out of pockets for 2020. The Choice Plan, there's that little bit lower max out of pocket I talked about. It drops down to $3,400, but it really drops it down on the out of network side at $5,100. The Choice Premium Plan, yes, it says it's $3,100. I get it. I told you that there are no copays, so how would you ever hit that? Well, CMS is not exactly set up for an MA plan to look like a med sup in that situation, so they require us to have a max out of pocket still, so I have to put it there. So it sits there, but there's literally no way anyone will ever hit that because it's 0 in network. It is $5,100 on the outside. And then the MA only plan is $3,000 in and $5,100 on the combined in and out. Again, no first dollar cost on the drugs on any tier because we do not have a deductible. We do provide gap coverage for all tier 1 drugs on all plans. And then as I mentioned earlier, it is the best in class inpatient exposure for 0 premium PPO and the HMO with those very, very low copays for the hospital stay. This is kind of a new slide for us. As a health plan, there's a lot of things. I don't know if you keep up with what's going on in CMS with some of the health plans in the past couple of years. You've heard things probably like VBID and uniform flexibility and some of the changes that are being made in the health plans where some of them are starting to offer social services. We have really started taking a serious look at social determinants of health. We're currently in the process of building out a program within our health plan to assess those things that members might need that might not fall into the regular set of benefits. We have already put some plans and some programs in place to assist with some of these, and we will continue to do so. Obviously, for this year, we put the first one in, this extra support for those that need it the most. You know, we started covering through the coverage gap, the COPD and asthma inhalers, such as Advair, Breo, Ellipta, ProAir, Steravent, Stiloto, and Symbicort. You know, we added all of those and made sure that people that could afford those. We knew that based on the data, the claims data, that we would see a drop off of people when they would hit the gap. They wouldn't take these inhalers. And that's a cost issue. You know, when they hit the gap and they're $200-300 for a month of these, they become cost prohibitive for people. We wanted to put this in place because we feel it's more important to pay for those inhalers and make sure people have them in their hands to use them as they should, rather than them not be able to afford them, then wind up in the emergency room and spend the money anyways. It's a bad situation for the member. They think they can make it. They think they can be okay. They just don't have the money. We don't want them to have to make that decision. We want to make sure that we can make this affordable for them. The second thing that we put in last year was the post-discharge meal benefit. You know, we really didn't know exactly how this was going to work when we rolled this out, but it really came to head as we created a program around how to manage it. So we designated one of the members of the healthcare concierge team to really help run and manage this program. So how it actually operates is that if one of your clients winds up in the hospital as a care and care member, the day they're discharged and they get back home, that concierge actually calls them, walks them through. Do they understand everything that happened? Do they understand their discharge papers? Do they have their follow-up visit set up for their primary care physician to make sure everything's okay? Do they have all the medicines they need? Do they need anything to get transportation or whatever to go to that appointment? And then also, is there somebody there that can feed them? Do they have access to food? Because most of the time, especially when you come home from the hospital, if you live by yourself, or maybe, you know, it's two elderly folks living at home together, one of them may not be able to cook the meals for the other. So we wanted to alleviate some of the issues and really provide these meals. So we do this through these calls, and this is how we uncover the people that actually need this benefit. It's created a really nice program. We have noticed that it's reduced readmits for us, that people don't go back to the hospital, because we're actually wrapping some services around them and trying to take care of them before they have another issue. That reach extended itself into the next bullet here. Our chief medical officer started wrapping some other services around our members. We have coined this the REACH program, or Resources for Enhanced Access to Community Health. This is some more of that social determinant stuff, along with some clinical determinants as well. We started putting some programs in place to really help people that maybe they have needs that they didn't even understand what the needs were, or how they could be managed, or how that we could help them be healthier and live healthier, happier lives. The first thing we did is we put in some clinical monitoring at home. So if we have members that meet certain requirements, maybe that have CHF or pulmonary disease, diabetes, CAD, or high blood pressure, we actually put a telephonic monitoring device in their home at no cost to them. And this thing on a daily basis does things like measures their blood pressure, it measures their pulse ox, it measures their weight, all these factors and data that we could take in, and it's relayed back to a group of clinicians where they review it on a daily basis. If things look out of whack or not like they should, they reach out to the member and ask them if something's changed or what's going on. If they recognize a trend, they get them back in line to get back to the doctor's office to visit with their PCP or a specialist as necessary. You know, again, so that they don't let it get too far and get out of control till they wind up in the ER again, because that's obviously not what anyone wants to happen. Next thing that we've rolled out is some in-home support care management and some palliative care. You know, this is a really, really important thing, I think, to folks, is that when you look at how you receive care and what care you receive, care should never be designed to look the same for everyone. Unfortunately, up until last year, you know, CMS's take on this is what you do for one member is exactly what you do for another member. With some of the changes that they've made, they've allowed us now to be more flexible in what we do, how we do, and what we can do for people as they have different needs. So now when we recognize people might have needs that require some different care management and need some in-home support, like with help with setting appointments or getting a social worker to work with them, we're actually wrapping some of these programs around through some of our community partners to get some of this done. The third thing is an implementation of a Living Well telehealth counseling to help make healthcare decisions and ensure beneficiaries receive care in the manner they desire. This is tied in with some advanced care planning. You know, most of the people that you guys, if you sit down with them and you ask them about how they want to end their life and how they want their health care to be done, most folks that say they don't want to die in a hospital. You know, most people would rather be at home with family and loved ones surrounding them. But unfortunately, they never do the things when they're healthy or when they can make those decisions to ensure those things are actually happen. So we want to work with people and let them know that there are options, and we offer these services to help people make these decisions at the right time in their life to make sure that they get what they want out of their health care. You know, some people may say, hey, look, I want to fight for everything I need to try to cure myself. And some people may say, you know what? I just want to let nature take its course, and I want to be comfortable, and that's all I really want. We respect both of those decisions, and we just want to make sure people's wishes are taken care of in these situations. And then the last bullet down here, we have started some medication management programs and some education through Adhere Health. They do outreach to members to make sure people are not only getting their medicines, but they're taking them at the right time and in the right manner. And if they're going and seeing multiple doctors, that they're not interacting the wrong way and causing problems that they shouldn't have. So again, we're trying to make sure people get what they need out of the things that they actually want to get from the health plan. So we're excited about some of these programs.
That's really cool, actually, Scott. You know, as I just heard you like rattle all that stuff off, I'm thinking of, you know, the type of person you come across that lives by themselves and they have one of these chronic illnesses, and you just know that they're in a vulnerable situation. I don't know of any other plans out there that really take that level of care of that type of sensitive consumer out there. I think about, you know, some of my own family members that have been in similar situations, and the fact that this plan is local and that you can really deliver this high level customer service, you know, added value to that clientele. So I think that's a great benefit and definitely a differentiator out there in the market.
Yeah, thank you so much. It's just, it speaks to the localness of what we do. We're also working on a program that's not up yet with Texas Health Resources. It's going to basically bring acute level care in home. So instead of having to go to the hospital for some acute issues that you might wind up in the ER for, we're building a unit that has, with a company that has cars basically, that has x-ray machines, things like that they can actually go in the house and do acute levels of care in patients' home rather than having to go to the hospital. Cheaper setting, much more comfortable for the patient, and it still delivers the same quality and level of an experience that they need.
And it just shows too the power and the horsepower really behind the partnership between Care and Care and Southwestern Health Resources, and how now you're really able to dive deeper into that quality of care that the plan provides.
And this is only really the first year. They're still trying to figure out what it means to own a health plan. So this is, I can only see this continuing to grow and to evolve into more services, because they will tell you they would love to be our only network, which is not plausible really, because you just can't do that. Sure. But for those folks that are, I encourage brokers, sign them up for a THR physician or a UT Southwestern physician, because that's where really Southwestern is going to get those synergies to really drive and really wrap the things around them, even at a higher level that aren't even plan related, but are truly Southwestern related as well. So there's just so much that they can get out of that.
It's great. It's great.
And I think the final thing here of note from a slide standpoint is extras. Everybody wants extras. That's what health plans are about. Deft research, when you look at that, everything is all handled that. Extras are what make people buy. They don't even include dental in the surveys anymore because everyone wants dental. I mean, that's going to be the number one thing. But, vision's always up there. The hearing aids are up there. But what was really funny is if you look down at the bottom, one of the things that we added this year in the national research was that one of the biggest buying decisions was actually OTC benefit. So for 2020, we are adding an OTC benefit. It's going to be done through a relationship with Medline. Medline actually owns the Curad brand, so if you've seen that brand in store, that's the company that owns that. We are going to allow $30 per quarter on every plan, no matter which plan you choose. You can do it. You can order them online. You can order them through their website online. You can call, or they actually have a paper form if for some reason the member wants to do it that way. If they do online, or if they do the telephonic order, the average turnaround to get it in the member's house is 1.4 days. Because the distribution center is actually sitting on the south side of Dallas County. So it's very, very close to make sure that we can get those things. And we did some different things with our OTC catalog as we thought about these wraparound services. I've looked at a lot of the OTC benefits, and it's vitamins and aspirin and Band-Aids and stuff like that. You only can buy so many Band-Aids. You only can buy so many aspirin. I mean, once you get 365 daily vitamins, you don't need any more for that year. So we're trying to put things in our OTC benefit like safety devices, night lights, grab bars, slip mats, things like that can still be bought with these benefits that are a little bit more durable, that'll last people a little longer, so they're actually getting some true value out of this. Our goal this year was to try this and sample this if it's successful and if it does what we want, we fully intend to expand this benefit moving into 2021. But we just wanted to start this year and, and make sure we did something. Back up at the top, preventive dental, obviously still included in all plans. That's your x-rays, your oral exams, your cleanings, and if a member already has dentures, they'll do the adjustments as part of their preventive stuff. You can still add the dental rider. It's still going to be $18, still includes the $2,000 annual coverage and dentures. That rider looks exactly the same now as it will next year. We're not making any changes. The vision coverage, again, that's through iMed. Your routine eye exam, including the refraction, is a $0 copay in network, and every plan has a materials allowance. This one for me, we have 96% in-network utilization on this benefit. I need your help as agents on this. I have 31 people that did not use the in-network benefit for this plan. It's frustrating because if they go out of network with this, the benefit is not as rich. They're not getting all their benefit. The iMed network is so large and so robust that they can find vision providers. No, it doesn't have Walmart, it doesn't have Sam's, but it does. It has Target, it has Pearl, it has Lens Crafters, all the rest of those places that they can go that are big places they can go to get their coverage. So please, when you talk to them about it, encourage them to use an in-network provider on this. The hearing aid coverage is still on all plans, stays exactly the same. We are keeping silver sneakers again for next year. And then the last thing down at the bottom, we are adding a true non-Medicare routine physical. Most doctors now actually bill a physical under the approved CMS code. People ask questions though, and I know members go, do I get my physical covered? The actual answer to that, based on the way the bid was filed for this year, is no, you only get the Medicare one. For next year, you will. If someone asks you, do I get my regular annual physical? Yes, it's covered for 2020. We are adding that to all plans at a $0 copay in network. So that'll be covered next year.
Does that cover things like a stress test?
No, that's just your normal go in where they run the full gamut of tests on you. Where they're going to go in and they're probably going to do their blood work every year. I just had mine. It's just your normal sit down with your doctor wellness visit that does more than what the Medicare annual wellness visit does, because that thing is very limited in scope for what Medicare says, because it actually, the annual wellness visit that Medicare does, it has things in it like diet planning and stuff like that. We all know when you go to your doctor and you do your physical, they go eat healthy. That's their diet planning. Work out, do some exercise. But they dig into more things when they do the physical, and they would normally do blood tests and workup and stuff like that. Gotcha. When you bill that 99 code that comes across as a physical, normally that would have been denied without this being covered.
Oh, great.
So even if they screw up and bill it the wrong way, it'll be covered next year.
Perfect. So no lab copay or anything like that.
Right. So if you look, depending on the plan, so if the plan has a lab copay, the lab copay would apply. But like the HMO, it has a $0 copay.
Okay.
The $0 PPO, I believe it's $5 in network. I think that's what it is. They only pay one, even if they run 6 panels of tests. You're only going to pay one $5 copay.
Gotcha. A question did come in on the chat from Jay, and he's asking on the $200 a month PPO, how are Part B drugs being handled? Would this be 20% coinsurance?
Jay, I want to answer your question. No, I don't want to answer Jay's question. No, I'm kidding, Jay. Sorry, Jay, I'm not going to answer your question. Well, actually, you're going to like the answer. It's 0, Jay. It's not 20%. It's still an in-network benefit. I got rid of that one, too. Literally, every in-network medical benefit is 0. If it's covered under Part B, it's 0.
So for somebody that can't get guaranteed issue on a med sup, but has a lot of maybe chemo or has...
Your ears are spinning now, aren't they?
That's where this plan really comes into play. So that's a great question from Jay. Beatrice Rivas, you raised your hand. Everybody's in a listen-only mode, so Beatrice, please just hop onto the chat and just ask a question, and we'll make sure we get it answered. So keep those questions coming, guys. Thanks.
I think that actually is my last slide. So yeah, I'll be glad to take any questions. I mean, I think the discourse and the conversation is really, really good. I'll just say that, look, I didn't go through all the benefits, because if you look at our 19 benefits, they're almost exactly the same. I went into this year trying to make sure that we changed as little as possible. We added the OTC benefit, we lowered the max out-of-pockets, and we eliminated those copays on that plan one. But what you're going to see for the most part on like the 0 premium PPO and the HMO is that they're going to be very similar. And that for me, that's a thing that is very personal to me, because I know as an agent, when I sign somebody up for a plan, I wanted the plan that I signed them up for today to still be that plan tomorrow and the year after and the year after. So I try to take that into consideration. And it was tough for me this year to go change a $119 plan to a $200 plan, because I have like 1,500 people that are in that plan that I just raised their premium $80. but I feel okay doing it in this situation because I think they're going to get more than $80 in benefit out of it.
Absolutely.
And then the reality of it is if for some reason they're not, I have a couple other options that if they weren't spending at that level anyways, they probably shouldn't have been in the plan anyhow. They probably should have been in the $55 plan or even the $0 plan.
Right.
So, and if I can move them out of a high dollar plan into a lower plan, I'm still saving them money.
Absolutely.
You know, we're still putting them in a better situation.
Yeah, absolutely. Well, Beatrice put something in chat here. Is the MA only, or does the MA only also include the OTC benefit?
It does. So every plan, so our extra benefits, I do everything I can to make sure that they're not different between the plans so that you're not trying to sell a specific plan for an extra benefit. We want to provide those across the board on all plans so that you can actually fit members into the very best plan that they can be in.
Absolutely.
So, I'll get there one day, Fred.
Fred's asking Scott if he's going to continue moving far west into the Lubbock area next year.
Well, I'll tell you, we don't know where we're going to go, Fred, but one thing I know is that we have a license in the state of Texas to do business, and I've got a pretty aggressive parent company that wants to grow a health plan. So, you know, I don't think anything's off the table. It just has to obviously make sense. And whenever we go into an area, we want to make sure not only can we do it, but we can do it right and deliver on what we do. And obviously, the further we expand our footprint out, the harder it is to maintain our local status. So probably something as far away as Lubbock would mean I would have to duplicate some operational things, such as my member services and stuff like that, because I really wouldn't want to put them all in Fort Worth because I couldn't tell my agents in Lubbock that, hey, your members can walk in if by chance they draw on a drive to Fort Worth. So I think there's some challenges, but, you know, I'd love to come to Lubbock. I hear they need some help out there in the MA space.
Yeah, and for all of you that are on the call today, if you don't have a Care and Care contract, this is the year you really need it. You know, looking at the benefits, you saw the $2,900 MOOP, you saw the no drug deductible, you saw what they do for their members on the service side. I mean, this is the year where you've got to have Care and Care in your briefcase. You look at some of the other carriers and how they're investing in benefits and they still don't really compare to the Care and Care plan. So please give us a call today. Reach out to one of our local marketers, call our 1-800 number, or just log in onto our website, www.thebrokeraginc.com, and we will be happy to get you contracted today. Another question came in here into chat, and that's what marketing tools will you offer this year? So I'll let you guys.
So I'll answer this in two methods. So first of all, our marketing plan overall this year is to, we're going to do a very, very heavy direct mail campaign that we hope to generate leads that we are going to work with the brokerage on distributing some of them back to try to get you guys into some traffic for Care and Care. We are doing digital as well to do the same thing, as well as a very, very heavy television run. Some of the tools that I think that we can offer you is we do create flyers that that you guys can brand and use, that you can put in places and things like that. We'll continue to have our benefit highlight fold-out piece that you can use. It still has the die cut in it for their business card, so you can put your business card in it and put it out in places. We're really flexible in this from this standpoint. I mean, Beatrice, if you have ideas and things that you'd like to work with that are questions that maybe we could help you with, you know, I encourage you to reach out to Jamie and to Josh and to Tana, and let's see what we can figure out how we can put some tools in your hand, maybe that might be specific to you. That's the other great thing about us being local is that I don't have a set. I mean, we have some canned pieces that we use, but we're really flexible. I know Jay's on the call. We do stuff with Jay, some very different things with Jay to try to help him out as well. So we're definitely open to working with you and helping you. There was another question earlier about, roll back up to that question about AHIP, the question about AHIP. Who asked that question?
Let's see, that was Al.
Okay, so you asked about AHIP, and I told you that when CORE came up, you could take that. Tana actually just got an email while we were here, CORE is up. So you can go now, and you don't have to use AHIP. Our own private training will be ready, so you can do it now.
And also just in terms of AHIP, once you write 5
Angela.
Care and Cares with the brokerage, we will pay or reimburse you for your AHIP. So we have an AHIP reimbursement program. 5 enrollments get you a full reimbursement on your AHIP, so keep that in mind. Oh, Angela, I'm sorry. It was Angela Hargis.
And we'll probably have some kind of a contest that ties into that as well, because we know, you know, agents can't get paid during AEP for their sales. So we always like to kick some kind of a contest off right at the beginning of AEP to put some money back in their pockets, and we can reimburse from that too. I don't care that y'all did, we obviously can as well. So they can, I don't care if you double dip off me if you're right in business. That's a good program for us both. One other thing that I wanted to mention is, well, a couple other things. So commissions, because that's always been a thing historically. Caring Care's had its history of commission issues over the years, and in the last couple of years, they've been great. They've been really, really good. We do commissions really, really well. But I still notice some things where I always want to continually try to make this better, because I always want to be better than we have been. This month, starting this month with the commission payments that are about to come out, there is going to be a change in the way commissions are done. Historically, we have always paid commissions. So if you wrote an app in June for an August start date, we did not pay you until August. We waited until it was actually effective to pay you. We have changed our process on that. So now you will get paid for any app you write the month following, regardless of the effective date. So like if someone wrote something in July for a September effective, they're actually going to get paid for it in like next week.
Oh, wow.
So and if it's already on CMS's comp file showing it's an initial sell, they will get the full payment right then. We won't prorate it and then catch it up. If we can pay the full payment right then, we will go ahead and pay it. I'm trying to get money in your pockets faster. I know how it is.
Yeah, no, that's a great benefit. Agents always want the money as soon as possible. When do you pay your January 1 effective?
So my goal is to normally pay them on the 2nd.
Okay.
So we encourage every agent, if you are not on direct deposit, you're crazy. Sign up for direct deposit. It's literally a form you fill out and you send to Tana or to Tom, and we'll get you on direct deposit, because our commissions and we actually have a finance team that supports sales now. So it's really, really nice. I finally yesterday, was it yesterday or the day before, I finally had to look at them and go, I can't help you anymore. You guys are too good at this. I don't know how you do this anymore. It works. I don't want to help you. So I used to have to try to do this and manage this, and Tana was doing it. And over the last 6 months, slowly, Tana and I have pulled ourselves out of having to do the work, because the finance team has just gotten so good. They're focused on the health plan, and they understand how important it is to pay our agents. They even fight our parent company on timeliness and making sure it was done, because that's the way they are. They're focused on paying our agents is what they're focused on. And then the next thing I'd like to talk about is an agent portal, because I know it's something we've never had. It is in the final stages of design. This agent portal will have all your commission statements in it. The first rollout will be the agent level. It won't be the FMO level, sorry guys, but it will be the agent level. You'll be able to go in and see all of your historical commissions. The way the database is going to be set up is that you can export them by a month at a time like the other carriers do, but you can also go in and put in a member's name, and it will literally pull up historically every time you've ever been paid for that member. Anything that's ever happened with that member, you will see it. Back to 1/1/19, we had to start at a date. So it's starting at 1/1/19 moving forward. So we think this is going to be a really nice tool, so that you can go in and see exactly what you've been paid, what you haven't been paid, all of those things either on a monthly basis or on a searchable basis. The second thing that we're finishing up the file for right now is the ability to check app status online. It's going to be tied directly into our enrollment system. So you as an agent are going to the exact codes that our staff would get. Basically, it'll say pending or active but not confirmed or active or whatever, and we'll give you the definitions of all those for what they mean. But you're going to see the exact same things that our staff sees. Okay. So that'll be really, really nice as well. And then the third thing is we are finishing up a materials portal, which will allow you to order materials online, not just kits and stuff, but also things like if you want to build your own marketing pieces and stuff like that. We're also setting up with this vendor, if we want to co-op with an agent or partner with them, we can put money on their account and they can just go in and order it. Or if they want to do stuff on their own and they want to spend some of their money to do pieces, they can go in, set everything up, print it, pay for it, and it'll ship it to them right where they need it to be done. But you'll be able to order, sales kits, things like that on there as well. So we're working on bringing that up so it's not a manual process.
Excellent. And then Angela put in chat, just provide the name again for the contact person to get appointed today. So if you're looking to get contracted, I would just encourage you to call the brokerage, 469-635-6000, and just ask to speak with Laura Jordan, and she can get you contracted today. If you're looking for certifications or anything like that, then you can just ask to speak with Jamie, and she can help guide you through any of the certification process. And then if you're looking for like the local team here, how to get in touch with Tana, again, just call our main line, and we can get you her personal information. I did see that Dola Lebouf raised her hand. Dola, if you could put that question in chat, we've got Scott and Tana here ready to answer any questions you may have. And that goes for anybody else that has any questions that you might want to get answered. We've got a few minutes left here, so we're happy to answer those questions. So Dola just got it. Please reiterate when you mentioned what you mentioned in all counties.
So what I was talking about is that all of our plans, all 3 PPOs, the MA only plan and the HMO, you don't have to think about which of what will be our 13 or 14 county service area you're in, which one of those counties you can sell which plans. All plans are available in all plans that we cover for our service area.
Excellent. Excellent. Well, guys, we really appreciate y'all being here today. This was just great information. We're so excited about Caring Care this year. Can't wait to see you guys at our product kickoff. That's going to be September 4th at a brand new location. It's not at the Grapevine Convention Center this year. It's going to be at the DFW Lakes. It's a Hilton hotel in Grapevine. So be on the lookout for the invites that are coming out for that. And we're just really excited to have you guys out. One more question here in chat, and that's, what is the deal then on Cook County?
So we're going into Cook County for 2020, and we will have all the products will be available up there. If you can clarify what you're asking, what is the deal? I'm not sure what you're asking me there. I mean, we'll be there with all our plans.
We'll give her just a couple seconds to respond to that. But again, everybody, we really encourage you to take a hard look at Caring Care this year. If you need any kind of supplies or product information, we've also got our product specialist who is Polly. So if you call our main line and just have any product questions or need any help, getting materials and things like that, Polly is here to help you as well. So here came the response to that from Dola, and she's saying, if all plans open in all counties, why mention Cook?
All counties in Texas.
It's not all counties in Texas. It's only our service area.
So Dola, what we'll do is we'll have Tana reach out to you. Do you have her contact?
I do.
Okay, yeah, and she'll make sure we get that clarified for you. But we appreciate you putting those questions in chat. So with that, again, everybody, this conversation and this entire presentation will be posted on our website, and it'll also be sent out to all the attendees. So you can go back and listen to this again, and all this information will be available on our website at www.thebrokeraginc.com. We can't thank you enough for being here today, guys, and y'all have a great afternoon. Thanks for your time.
Thank you, everybody.
Thank you.